is Chase, and this is my presentation on dyslexia. Okay, first I will go over what dyslexia is, and that is a language-based learning disability that affects the skills related to reading and writing, like with what we talked about in class, such as having a problem with oral or speech sounds and decoding words and letters. That could lead to problems in other subjects because every subject involves reading and writing. Dyslexia also causes difficulty with specific language skills, and these skills include listening, speaking, reading, and writing. Dyslexia also leads to issues with logical processing problems, with substituting and syllables. And dyslexia is also a disability that affects many people because dyslexia is the most common disability. 1 in 5 people suffer from dyslexia, and about 70 to 85% of children who are placed in special education for learning disabilities are dyslexic. And I've got this information from Dyslexia Basics and 11 Facts about Dyslexia. Okay, next I will go over the characteristics of people with dyslexia. And people with dyslexia, have difficulty in acquiring and using written language. And people with dyslexia, have these issues with writing out their thoughts and what they think. People with dyslexia also have difficulty in learning letters and sounds. They have problem and difficulty with learning new words or creating new words. People with dyslexia also have difficulty in comprehension. It means that people with dyslexia usually cannot tell you about what a story or a text means or their understanding about it. And people with dyslexia also have difficulty in learning to speak because it is a language-based disability. And I've got this information from Dyslexia Basics also. Now I will go over the brain and dyslexia. And scientists over the years have learned more about the brain and dyslexia as a result of technology. An example of this would be the MRI. Brain imaging gives us a better understanding of how dyslexia affects the brain. The brains of people with reading that had dyslexia for group reading showed abnormalities in several brain regions and pathways related to language. I thought that was interesting. That's the reason why I put that in the PowerPoint. The brain regions that are known to be involved in dyslexia are also altered by learning to read. I guess hence is a reason why people with dyslexia struggle with reading. And I got this information from Dyslexia and the Brain. Now I will go over what causes dyslexia. And as we all know, it is a very complex disorder in which the exact known cause of it is not known. Here are some probable causes some people may think may be the reason, such as genetics, something that you could be born with, the environment. It could be, where you live and the conditions of where you live can be a factor. Hearing problems, I guess I'm not sure about that one, but and it said brain and head injury could be trauma that could cause it. Now we will go over how is dyslexia diagnosed and treated. The first part. It is very difficult to diagnose exactly because, like we went over to the other slide, there is no exact known cause for dyslexia. And dyslexia can be diagnosed through multiple methods. It can be even diagnosed using observations in the classroom, testing of specific language skills that from previous slides are listening, speaking, reading, and writing. Okay, this is the second part of how is dyslexia diagnosed and treated. And dyslexia is diagnosed and treated, through a formal clinical evaluation. And it is needed to determine if a student has dyslexia, and this test is provided by a qualified professional. And these professionals usually, are a teacher or a literacy specialist to consider a student's response to intervention, or RTI for short, or classroom instruction. There are different areas being tested for dyslexia, and as you know, these areas could be phonological awareness to test things such as syllables, rhymes, onset rhymes, words, and sentences, and also could include phonemic awareness such as testing to see if they could isolate, blend, segment, add, delete, or substitute words or sounds. Also, phonics with letters, it could be tested. Spelling and writing could also be tested. Treatment for dyslexia is usually made between the teacher and parents, and I'll go over that the next slide. And I've got this from Dyslexia Assessment. What is it and how can it be? How can it help? Okay, now here are some accommodations and modifications for students with dyslexia. Okay, first, highlight important text. Teachers can use audio and or tape recorders. Give students extended time on assignments. Have a spelling and grammar check. And also, teachers use color coding. I like the color coding. And I got this information from Accommodations for Students with Dyslexia. Okay, now these are two additional resources for dyslexia that I like that I facts dyslexia childhood, the signs, clues to dyslexia from second grade on, reading in the brain, what are classrooms like for students with learning disabilities, assistive technology for kids with learning disabilities, teachers can use in the classroom, spelling and dyslexia, here's some strategies for summer reading for children with dyslexia, here's some questions and answers about dyslexia, and learning disabilities, dyslexia, and vision. Those are 10 pretty good resources on dyslexia. And spelling city. This is more of a teaching resource. You tell us dyslexia here's some. I'll read a couple of signs. Student might have dyslexia, may have difficulty sounding out unknown words, struggle with rhyming, delayed speech development, and little comprehension after reading. It also gives some strategies for teaching students with dyslexia, such as repeating, clarifying, and simplifying directions, highlighting essential information, maintaining daily routines, using graphic organizers, which I like using graphic organizers, providing additional practice and spelling activities for dyslexic students, and using assistive technology such as tablets. And here are also some resources for students with dyslexia, such as focusing on phonics to understand letter and sound correspondence, building vocabulary retention and reading comprehension with just 10 minutes of daily practice, include printable worksheets to supplement spelling and phonics concepts, visual aids, and allow for review time so students can work at their own pace. It also, teachers find RTI is a multi-tier approach to helping struggling students where increasingly intense interventions are used as students' progress is monitored. These were really good additional resources that teachers can use. And here are my references and my sources I've used in this PowerPoint. And that is it.